Hey, welcome to The Explainer. Today we're going to pull back the curtain on something amazing, how nurses are actually made. We're going way beyond the textbooks and into the skills lab, where the real, hands-on, high-stakes training actually happens. This is an inside look at the foundational skills that literally save lives.
Okay, so here's how we're going to break it down. First, we'll look at the surprising art of bed making. Then we'll get into decoding the body's signals. After that, we'll see how nurses turn raw data into a diagnosis, and what happens when theory smacks right into reality. And we'll wrap it all up by getting to the very heart of nursing.
All right, so we're starting with something that, let's be honest, we all think we know how to do, making a bed. But what if the person is still in it? What if they can't get out? All of a sudden, a simple chore becomes this incredibly complex clinical skill. And this is often one of the very first places where a nursing student's training gets real.
Yeah, this is called an occupied dead. And you might be surprised to hear that instructors say this is one of the toughest fundamental skills to master. And you gotta ask why. Well, it's because you're juggling so much at once. You have to keep the patient safe, make sure they don't fall, keep them comfortable and feeling secure, all while using proper body mechanics so you don't throw your own back out. It's truly a delicate dance of precision and care.
So how do you manage that dance? You break it down into these really careful, deliberate steps. Every single part of this, from just explaining what you're about to do, to washing your hands, to positioning the patient, it's all built around safety and preserving that person's dignity. The process is so methodical. You change the linens on one side of the bed, then gently roll the patient over onto the clean side. It's a system designed to cause the least amount of disruption possible.
And the level of detail here is just wow. Even the corner of the sheet isn't just tucked in, it's mitered. This specific 45-degree fold isn't just to look neat and tidy, it actually secures the linen so they don't bunch up and cause wrinkles. And that's critical, because for a patient who can't move much, those wrinkles can create painful pressure sores. In nursing, you learn really fast that every single tiny detail matters.
This was a piece of advice the instructor hammered home, and it applies to way more than just sheets. She was talking about gloves. In a hospital, infection control is absolutely everything. So this simple, powerful rule, if you're in doubt, change it, it just cuts through any uncertainty. It's one of the first lessons that teaches students that patient safety is completely non-negotiable. Period. So let's move on to the next building block. We're shifting from a physical task to more of an intellectual one. Once the patient is clean and comfortable, the next step is assessment. And that's all about learning to listen to what the body is trying to tell you through its vital signs.
Students learn pretty quickly that a patient's body is constantly sending out signals through these 5 key indicators. You've got the classics, right? Temperature, pulse, respiration, blood pressure. But look at that 5th one, pain. Recognizing pain as a vital sign was a massive shift in medicine. It basically forced healthcare providers to take what a patient feels just as seriously as the objective numbers on a monitor.
Taking a temperature seems simple enough, right? Wrong. This table shows you just how much clinical decision-making is involved. There is no one-size-fits-all method. Do you need the most accurate reading possible for a very sick infant? That might mean a rectal temp. Is your patient unconscious? Well, then oral is obviously out. Students have to learn to weigh the pros and cons of each method to choose the right tool for that specific person in that specific situation.
Now this is the normal range for how many breaths a resting adult takes per minute. If it's way higher or way lower, that's a huge red flag, a signal that something's wrong. But here's the tricky part. How do you get an accurate count?
And here's the secret. It's a great little trick, because breathing is something we can control. If a patient knows you're counting their breaths, they'll unconsciously change how they're breathing. So instructors teach this clever move. You pretend you're still taking their pulse at their wrist, but really, you're watching the rise and fall of their chest. It's a small deception, for sure, but it leads to a much more accurate piece of data.
Okay, so now you've got all these individual data points, a temperature, a breathing rate, a pulse. How do you learn to connect the dots and see the whole picture? Well, you do it with case studies. These are basically clinical puzzles that students have to solve. So in this case, the students get a list of clues. The patient's skin is warm and flushed. Okay, that probably means a fever. They have tachycardia and tachypnea, which means their heart and lungs are working way too hard. And then the kicker, you hear crackles in the right lung base. That's an abnormal sound that means there's fluid where there should only be air. So what is going on here? To solve the puzzle, they don't just guess. They use something called the nursing process. It's the systematic 5-step framework for thinking like a nurse. They've already done step 1, the assessment. That was all the data on the last slide. So based on that data, they move to step 2, diagnosis. And the nursing diagnosis here is impaired gas exchange. The medical condition that points to? Pneumonia.
And that diagnosis leads them directly to a plan and then implementation. Look at how every single action here is a direct response to the data. The patient has impaired gas exchange? Okay, give them oxygen and raise the head of the bed to make breathing easier. They have a bacterial infection causing it? Let's get those antibiotics going. This framework is what turns them from being just data collectors into active, life-saving problem solvers.
But here's the thing. Learning all of this in a classroom or a lab, that's one thing. Applying it when you're under pressure in the real world, that's a whole other ballgame. And sometimes the most important lessons are the ones that come from failure. This next part, it's a serious reality check.
You know, you can make a perfect occupied bed on a mannequin 100 times. You can ace a quiz on vital signs. But what happens when the test isn't just about spitting back facts? The real challenge, the real test, is proving you understand the why, not just the what.
This was the sharp, just brutally honest feedback an instructor gave to her students after they tanked a test. It turns out they had gotten their hands on questions from an old exam and just memorized the answers. But the instructor had changed the questions just slightly, and because the students hadn't actually read carefully, because they hadn't truly understood the material, they failed. And this right here is the core lesson of their entire training. Nursing is not a multiple-choice test. Memorized facts are fragile. They just shatter the second a situation changes. But true understanding, that's flexible. That's what lets a nurse adapt to new, unexpected problems on the fly. That tough feedback wasn't just about a bad grade. It was a lesson in clinical survival.
So after all the skills, all the science, all the late-night studying, and the really tough lessons that come from failure, what is it all for? What's the ultimate goal here? Well, the director of nursing at the school, Dr. Susie Chen, she tells us exactly what it is.
And this is what it all boils down to. Every single detail, from that mitered corner on the bedsheet to the secret way of counting breaths to the critical thinking needed for a diagnosis, it all leads to this one profound truth. A great nurse doesn't just treat an illness. They fundamentally improve a person's quality of life. That is the why. You know, when we see a nurse at work, we might just see them performing a series of tasks. But when you peel back the layers like we just did, you see so much more. From a simple folded sheet to a life-saving diagnosis, every single thing a nurse does is a skill that has been learned, practiced, and perfected. It's a powerful reminder that behind every competent, caring nurse is a long journey of intense dedication, critical thinking, and a deep, deep commitment to making our lives better.